Another case of monkeypox has been detected in the Western Cape. A 32-year-old male has been traced to have tested positive for monkeypox. The first case was detected and traced in Gauteng from a 30-year-old male. We are here with the Minister of Health in the Western Cape, Dr. Noma French Mbombo, to talk to us more about this disease. Minister, just talk to us about this disease. Can you confirm that this case has been found in the Western Cape, and also what can people look forward to?
Yes, indeed. The National Lab informed us yesterday afternoon the confirmation of a case from a 32-year-old male in Cape Town, which becomes the second in South Africa, which is the first case in the Western Cape. I must also reassure the public that at this stage, we shouldn't be panicking because not only it's not yet a notifiable condition, but it's not as highly contagious, and at this stage it's also mostly through the contact. And also we urge the public to stick to hands hygiene, especially when you have been in parts of, like in the gatherings, because it's through direct contact, because you might be shaking people's hands and all of those. And also as an individual, if you have got signs, symptoms of presenting with the flu, because by the time the blisters show, it means that the virus is already inside you, please come to the nearest health facility, because you won't be able, whether it is a chicken pox or is it a smallpox, which is very rare because most of us are vaccinated in the whole world with a smallpox, or it's a monkeypox, nobody knows. As for us, the health system, we are prepared in regard, because we have to conduct quite intensive contact tracing if someone has been exposed, which is in this case for this man in Cape Town.
And then after you do that contact tracing and you find those individuals, you identify them, what happens to them? Do they quarantine? Just talk to us about the process.
It is symptomatic, because most instances it's about where people might present with a headache, with the signs of flu and so forth. So where you have to actually treat the symptoms. But again, the issue of trying to check the others that they don't end up spreading it is part of this. But noting, it's not notifiable, so there is no requirement like the quarantine and isolation. But of course, just like even with the scabies, I'm just making some other rashes that we used to have. If someone has got scabies like at the school, it means that that person doesn't have to come to the school. And those children who might have been exposed, we have to check that they don't end up infecting the others. So I don't think for now it's about quite huge concern, but we have to stick to the basic hygiene. That's what matters. I must also lastly to indicate that, as with all other pandemics with the virus, although it is already, we have seen it in more than 20 countries internationally, and now it's coming here in South Africa. Normally, when the virus lands in different populations, sometimes it presents itself differently. So scientists are still looking at it, how it will end up impacting on this population, which is South Africa. So I don't want a situation now when it becomes serious or not serious. And then we said that calm down. But at this stage, it's not much of kind of you have to be, have an alarm around that.
I was going to say that, Minister, also with COVID, when it first arrived in South Africa, people were encouraged to just quarantine, and they were told it's not as severe. And also, because these cases are deemed as local transmission, what does this mean, and where could have they possibly got this? In this case, there is no history of travel, because as I indicated that it originated, I mustn't say originated. The first case in this pandemic, it was detected in the UK, and then it went to all other countries, like more than 20, Portugal, Spain, US, Canada, and so forth. So that we even have a case where there is no history of traveling. So it means that there is already a community transmission. So it means that there could be someone who traveled to end up, probably was not diagnosed, ended up now spreading it across, which is the same as it was with the COVID.
And also there was a stigma that is feared could be attached to this, because one of the press briefings that was given by the health department was that it's mostly susceptible to males who normally get in contact with one another. Just on that aspect, can you talk to us about that?
We should avoid we should avoid that kind of a situation, because remember, even with the HIV virus, which ended up being a heterosexual or heteronormative kind of a disease, there was always that kind of a stigma, and then we ended up sleeping as health workers. Whilst we always think that it's a gay disease, we shouldn't. As far as I'm aware, that with the UK cases, I think it started with the 2, they detected it at a sexual health clinic that is being frequented by a man sleeping with men, but it doesn't necessarily mean that it's because of that. It will be because they detected there. But as far as I'm aware, more than these 20 countries in the whole world, it's not necessarily among the gay or among the MSM, because this is what we call a zoonotic kind of family in terms of the viruses, which is through the contact, the lesions, which could be, because it could be anywhere on the hands. So what's that got to do with a man sleeping on how you sleep with anyone? So we shouldn't even go up to there. It's because they detected whilst they were coming for something else, and then they managed to detect it. But it doesn't mean that other people, just because it wasn't detected to any other types of health facilities, that it doesn't happen like that.
Minister, thank you so much for your time.
Thank you very much.
Minister of Health in the Western Cape, Noma French Mbombo, just talking to us and confirming that case of a 32-year-old male which was found to have tested positive for monkeypox in Cape Town, and also warning people to just stay clear of this disease, maintain their social distance, and also keep that good hygiene. Over 4,000 cases have been reported across European countries. Only 2 in South Africa at the moment, is also defying some of the stigmas that are attached to this virus. From myself, Atule, and my colleague Clinton Surf, back to your studio.